Do meds actually help sciatica? I'm Rob, and I'm a doctor of chiropractic here in the UK. And for over 20 years, I've been helping patients just like you deal with their sciatica. And if you know me, you know I love research. So I've gone through all the research about commonly prescribed UK medications that doctors will give you for your sciatica to see how they really work. And spoiler alert, most of them are rubbish. So hit like and follow me, and this is part of my Sciatica September series. I'm covering sciatica every day for the rest of this month. And in tomorrow's video, I'm going to cover what the research says about supplements. And honestly, a couple of those do way better than these. So let's dive straight into the medications, and we'll start with the flops. So we're going to start with NSAIDs, non-steroidal anti-inflammatories, like your ibuprofen and naproxen. So in the research, these medications barely beat sugar pills for helping your sciatica pain. And on the flip side, they also wreck your stomach too. Next is paracetamol. These are brilliant for your hangover, but they are useless for sciatica, and every single trial agreed. Pregabalin failed the big trials and caused more dizziness than any pain relief it gave. Oral steroids gave a tiny boost in function, but literally no change in pain levels. But don't worry, the mood swings come free. Opioids are a short-term band-aid, but a long-term disaster because addiction is very high. The guidelines say, please don't bother. So next we move on to the survivors, and we call them survivors because they've just scraped through. First is gabapentin. It's not a magic pill, but it is one of the few that actually showed some benefit for nerve pain. Next is amitriptyline, which is an old school antidepressant. It showed some benefit for nerve pain, but mostly it just makes you sleepy, so you probably just sleep through the pain. Most of the research was kind of patchy. And lastly is duloxetine, which is a medication meant for chronic pain. Evidence with sciatica is kind of flimsy, but it made it onto this list because it at least showed a little bit of benefit in some people. So in the UK, that's your prescription lineup right there. Gabapentin, amitriptyline, they kind of scrape through, and the rest, they're just disappointments in blister packs. So let me know in the comments, do you agree with the research? Do you think that most of these medications aren't particularly helpful, or have you found one that really helps your sciatica pain? I personally did find ibuprofen quite useful when I had sciatica, but like the research says, it could have just been the placebo effect. When the best options barely help and the rest are all duds, it leaves you asking the question,